have an initiative. It's the Cybersecurity MedTech initiative that we run. I'm going to let Heather Hansen, president of Biomed.SA, talk a little bit more about what Biomed.SA is all about and the collaboration. But we all know that cybersecurity has been important to the healthcare community for a long time. We deal with data privacy, regulatory environments catching up. We deal with PII, PHI, all the types of healthcare records and data that security that you can think of. But now we start thinking about this explosion of medical technology. We start thinking about all of these new devices that are helping to enrich people's lives, to lengthen people's lives. Really, it's just the beginning. And I think what we're going to start seeing is, a true proliferation of devices that are going to have some sort of, embedded software, connectivity, everything that as cybersecurity professionals we have to be aware of and be concerned about. So right now, looking into the future, really that is what our panel is going to discuss. And right now, what I'd like to do is, again, welcome all of you to San Antonio. And I'm going to turn it over to the president of Biomed.SA, Heather Hansen. Heather.
Thank you, Jeff. It's a pleasure to be here. So Biomed.SA is a nonprofit that is dedicated to the growth of the healthcare and bioscience sector in San Antonio, which is the largest economic sector, contributing over $42 billion annually to the ecosystem. And we'll go ahead and get started and jump into it, and I'll let the panel members introduce themselves. If you could talk about briefly your names, what your organizations do, and some of your top cybersecurity concerns.
Good to see everybody out here. My name is Chris DuPont. I'm the CEO and co-founder of a company called Galen Data. We are a purpose-built, hyper-focused, FDA Class 3 cloud designed and operating from a software perspective to make it easy to connect medical license to the FDA compliant cloud. In simple terms, most medical licenses today are not connected to the internet. There is no check engine light for medical license. Galen is providing the infrastructure and framework to make it easy to have those medical licenses transmit that check engine light to the cloud.
Okay, Tom?
Hello, my name is Tom Doe, and I'm the systems engineering manager of a local medical device company named Citadel Medical. We produce a diagnostic medical imaging device that provides laser energy ultrasound to produce a diagnostic image. When I talk about cybersecurity in relation to our company, what I'm concerned about is safety first and foremost. In that when we produce a medical device, we want to deliver the benefit to the patient and health department, as well as make sure that the type of energies we deliver to the patient to bring that diagnosis is within acceptable energy levels. In addition, since we are a medical imaging device, we interact with the hospital network to transit patient information in terms of images to and from that network. So making sure that our interaction from our medical device to the hospital network is secure, and that we are do the due diligence on our part to make sure our medical device does not become a platform for cybersecurity threats. And finally, this local device access and authentication. Using our medical device requires skill training, and we want to make sure that only authorized and trained users can utilize our medical device.
Thank you. Andrew?
My name is Andrew Evans. I'm a little bit different than all my peers up here. I am not in the medical field, so I'm a little underqualified. But I work for an ITSP, and I work with both medical, manufacturing, legal, public, private businesses. And so my interests are tangential to kind of what my peers are up here. And what is most important to me is isolating what the risk is for my clients and making sure that we tailor whatever security controls or methodologies that we apply in their environment is appropriate for them. Because sometimes not everything is worth spending money with that.
Thank you. And from the 5th largest hospital system in the country, Roby?
Good afternoon, everyone. My name is Roby. I'm the Director of Information Security and Insurance for Methodist Healthcare. That's here in San Antonio. We have about 8 acute care hospitals across the city and surrounding areas. multiple surgery centers, freestanding EDs and urgent care centers as well. We will also be building and opening 2 more hospitals before the end of next year in the San Antonio area. Overall, my team is responsible for, the administration, education, and monitoring of our, information security programs, privacy programs, and the information lifecycle management of our division.
Thank you, Roby. I think it's good to set the framework for these groups as they work together. So I'd like you all to describe the relationship between device manufacturers, hospitals, and patients, and how that affects cybersecurity. And we'll start with you, Andrew.
Yeah, so just like any other business, medical supply is very similar. We all have our supply chain issues. If you've attempted to order anything in the past year, it's been pretty miserable. Definitely if you're trying to order technology, switches, routers, chipsets for your equipment, it's incredibly hard to get right now. And sometimes the quality of the material that you get is always not the best. And unfortunately, that's just kind of the nature of our current supply chain. So the biggest takeaway that I have for working with my suppliers and people that are delivering equipment, so I can ensure that our networks stay up, to make sure that our environments stay up, to make sure that we continue to support and have availability to support patients and individuals and clients, is make sure that we plan ahead and make sure that we have a stockpile of equipment and make sure that we have the ability to replace something if it breaks. Because right now, if one of your switches breaks in your building, you wouldn't be able to replace it. Because Cisco currently has a 4-month back order for any enterprise accounts. So think about that when you're planning your manufacturing and planning your supply chain, is that you should always think a couple months in advance. Same thing for medical.
Thank you. And Chris, how about you describe the cloud to medical device manufacturer relationship?
Thank you for the question. So our customer is the manufacturer of a medical device. And if you don't know, there's 3 classifications. The FDA recognizes class 1, class 2, class 3. Class 1, it's tongue depressors. No matter how you misuse that device, it really can't hurt you. Class 2 is diagnostic, and then class 3 typically is licensing. Our focus is with the manufacturers of these class 2 and class 3 devices. It could be a laser, it could be a implantable heart pump, or it could be a modern EEG system. So we work directly with the manufacturer to provide safe and secure transmission, storage, and display. It owns a turnkey system. Again, we make it easy. We're very, very compliant with regulations and everything. I didn't answer the question the first time. Everything outside of security I'm worried about. So everything we do is focused on cybersecurity.
Thank you. So, Tom, from a medical device manufacturer perspective, how would you describe the relationship with the hospital?
Well, first, when a hospital is looking to buy our equipment, we want to understand that, one, it is delivered secure. So when we design, build, and test our equipment, we want to make sure it's secure. At least to everything that we know what we can do from day one. Second, our device interacts and communicates with hospital networks. So hospitals need to understand how to configure our system to be secure within the context of their hospital. So, information that we provide and our infrastructure, training, and information, those are all important parts of the equation. And third, there are access and authentication controls. We use RFID key cards to access our wastewater and input. So understanding how to maintain access control, configure and remove cards is also a very important part of the equation. And I think third is part of it is just because you deliver a medical device doesn't mean it's going to remain secure over time. So actively monitoring all the components that you build your security or your medical device with, maintaining active relationships with your vendors so that you can continue to receive those updates, and having a plan in place for upgrading and notifying, affected parties whenever updates do occur or events do occur is really important part.
Thank you. And Roby, looking at the other side of the equation, from the hospital perspective, what are your thoughts?
So my team and the support staff at corporate that help us, we're really there to make sure any product coming into the hospital, whether it be software, hardware, any type that's going to interface with the patient or that the provider is going to work with, we vet it for security and updates, and so it's really cradle to grave management of all those systems and making sure they're safe on our network and they're safe for our patients and that our patients are protected as well.
Thank you. I'd like to dive a little bit deeper and ask all of you if you could talk about a specific aspect of safety that is unique for the medical industry. At this time, we'll start with you, Chris.
Being in the medical device industry, compliance regulations is very important to us. And I always like to point out is that you can be compliant with all these regulations and still design a poor device. And so it's not just the compliance, it's you always want to operate at a higher bar. For example, Galen is ISO 1345 certified. That's a quality management system that governs how we manage everything from design controls to purchasing. Galen is also high trust certified, which is a fairly new certification for cybersecurity and protection of privacy of patient data. That's a framework we work within, and it will be audited by a third party. And so, in medical device, not only do you have to say you do it, but if you don't document it, you don't provide objective evidence, you don't do it. So we just got through an ISO audit last Thursday and Friday, and the auditor always says, okay, you say you do it, now prove that you do it. I'm sure all these guys can attest to that. So objective evidence, and once the industry complies, is very, very important in the world.
Thank you. A different aspect involves operating systems and particularly the older ones. Roby, how about you talk to us about that?
Yeah, I'm sorry.
Yeah, can you address the impact of old operating systems?
Oh, yes, definitely. So much like the manufacturing they talked about, we do, some of the very large pieces of medical equipment, MRIs is a good example. One of the biggest, vulnerabilities we see is older operating systems. A lot of them cannot be upgraded to, the current operating system. Sometimes they're, Windows 95 even, it's kind of scary. And it has a lot to do with FDA certification. So if you're messing with that software, you can also affect the FDA certification. So that's something we work very, very closely with the vendors on, as well as our network security teams on various ways to secure that, that equipment properly.
Thank you. Andrew, I'd like to ask you to talk about specific aspects of safety relating to passwords and medical devices.
Yeah, so the medical industry is very interesting in the sense that unlike any other industry, both confidentiality and availability are incredibly important. Because you always want to make sure that your phone is available to be able to assist people, to be able to help people, to be able to provide medical treatment. But you also want to make sure that their data is safe. So you have to learn how to balance these two items, definitely in, say, an emergent situation. So say where we do you need to have every system password protected? Do you need to have every system require two-factor authentication in order to log in? The truth is, that's not always the case. And so you have to figure out where you want to put in compensating controls in the medical environment to make sure that you're able to provide adequate security to make sure that this data is safe, but also allow doctors, nurses, medical professionals access to the equipment when they need it. The worst thing would be is that a doctor lock themselves out of their password when they needed critical information, right? So subsequently, making sure that you have controls to allow ready access, but also to have it for control. Another interesting aspect of the medical industry is it seems to lag behind our manufacturers and our other industries just because it is so regulated. We see that HIPAA takes about 2 or 3 years longer to update than, say, CMC or PCI and all those other federal-based compliance requirements. But we see them slowly starting to adopt these newer controls and password complexity no longer being enforced, allowing someone to keep a password for years. So the medical industry is very interesting about that.
So Tom, how would you address the intended use environment aspect of cybersecurity and safety?
Well, when you're designing a medical device, you you have to take into consideration what is this intended use, what's this indications for use, and the usability aspects associated with it. So depending on what classification medical device is, how it's intended to be used, for example, in a emergency environment versus a non-emergency environment, you have to kind of weigh the security controls and make sure that they are not, the risk of not being able to get into the device is not going to affect the usability of the medical care. So the intended use environment really plays a strong role in making decisions on how and what security controls and how you distribute and how you test and order to make sure that procedures are not only secure but usable.
Thank you. And I think everybody knows that cybersecurity is not one department or one person at a company. It's really got to be everybody. But in this industry, when patient care and life-saving activities are the top priority, I'd like to ask each of you how you promote cybersecurity in your organizations, given that backdrop of the healthcare being so important. Tom, let's start with you.
Well, I talked about designing for security. One of the other aspects that we have to be cognizant of, how do you react to security? So first off, you have to kind of know what your device is built of. All the different software components, I think it's called software build materials these days, that go to your medical device. Proactively monitor for those threats, have a team in place to assess those threats, and work, collaboratively, because there are a lot of people involved, regulatory, engineering, software, to come up with a effective solution and then design and deploy those. So, it takes a team to really build it by security. Having really good communication between all the teams, including your vendors, is really important part of it.
I can hear Steve breathing a little bit.
And Roby, following up on that is the need for user education adoption in the clinic as a hospital, as well as your own procedures. How do you promote cybersecurity at this hospital?
Hospital level, I think the most critical, and it's probably the same in a lot of industries, is senior leadership buy-in. Without that, really a program is almost destined to fail. So that senior leadership buy-in, pushing the message down to the line employee, and we're very fortunate. That's kind of my team's role is getting out there, rounding on the hospitals and the different units and wards, doing in-person corrections when needed. If we see say a password on a little notepad sitting next to the computer, and then just really educating the providers and also the nursing staff on what's important, why cybersecurity is critical.
And Andrew, as a third party that is helping the healthcare industry, how do you promote cybersecurity in your organization?
Yeah, so kind of building off what Roby was mentioning is that when we look at cybersecurity, the best methodology now is a shift left culture. So putting it in the user's hands to make your systems more secure. It does not matter how many technical controls that you put into place. If someone scans their password to someone, it's all circumvented at that point. Just because a password is hard for a user to guess, we're enforcing complexity, your password has to be 24 characters long. That's not hard for a computer to guess. So subsequently, where do you balance that? Based off of last year and government research, you're more likely to give an attacker your password than they are to guess your password. So subsequently, making sure that it's a part of your culture, that you're not writing down the password to your EHR application on your computer screen, or it's on your keyboard, it's on your mouse pad, or it's in a notepad on top of your desktop. Those are the issues that we just kind of have to address culturally with our environments and making sure that our leaders in our environments, not just our senior leadership, but all the way through and trickling all the way down to the lowest tier, that everyone knows that they have a role and that they can make a difference by making sure that they see that, they stop that.
Thank you. And Chris, what about you? How do you promote cybersecurity in your organization?
We all know that the human is the weakest link. Sharing passwords. Nobody in this room just has one password and one user ID. And so we use a framework, ISO 13485, and no, that's not directly related to site security, but it does have that configuration change. We use multiple ways to protect the system. I don't have access to our data. The one thing that's unique about us is cybersecurity, it's a shared risk. We work directly with the manufacturer. And so we have to understand that there is a shared risk. We have to trust the manufacturer to protect their passwords. So they have to trust us. And so it's culture. I trust us provide us the framework too. That so we do efficient attacks on ourselves. It's an evolving threat. It's not something we want. So this meeting, this summer, is part of that constant evolution of trying to figure out how to always provide the best cybersecurity.
Thank you. Tom, you talked a little bit about monitoring and keeping up to date on cybersecurity threats. Can you expand a little bit more on how you get customer feedback and report back to customers?
Yeah, so when we develop a medical device, or actually it's a very formal process for how we have to respond to customer feedback, whether it's CAPAs, complaints, malfunctions, those types of that type of information needs to be reported to our organization. And once it gets into our organization, we have a team that we go through and we analyze the feedback to see if there's any associated risks, any associated cyber aspects. And at that point, we tailor our decision making to that. It may be something that already exists in our risk profile because we do an extensive characterization of our threats when we're putting a device. And in that case, we call it action. Otherwise, if it isn't, then we have to update our risk profile and decide to action.
Thank you. Roby, how does the hospital system monitor or employ resources in order to keep up to date on cybersecurity threats?
Sure, one of the big ways we do that is through HISAC, and I'm sure there are other industry organizations just like this, so it's the Health Information Sharing and Pumpkin Center. always gets me, but so it's just a nonprofit organization hospitals can join, and it's where we share ideas, talk about the latest threats, if you've been affected by those and how you mitigated or handled those situations. I think those are the biggest ways. And then other professional organizations out there, there's HIMSS, the Health Information Management Systems, and also China College of Healthcare Information Management Executives as well.
Thank you. Andrew, how do you keep up to date with threats?
Well, there's a lot of them. There's a lot of different methodologies for learning about threats. One of my favorites is actually Twitter. If you follow the right people, you'll get notified before the government does. And also subsequently, our government does do a very good job at having news feeds that will email you directly when they find an alert or they issue a news statement. So both CISA and MITRE both have news feeds that you can link directly into your mailbox and you get notified every time a new CVE is released. I don't recommend that. There's a lot of them. And that's kind of where the issue becomes. It's really like drinking from a water hose when you start looking at every security threat that's released daily. Just yesterday, 14 CVEs were released, all affecting different systems in different ways. And if you have to go through those and feed through those and think about if those affect your systems or not, you're not going to have action on those items that you get because you're just going to be overloaded tomorrow when you get 14 more. So the biggest issue when you learn and try to find out what you are vulnerable to is know what you have and know what systems you do have. So if something is released, you can say, oh, yep, that's us. And you can take that one email, that one item, action on it, rather than having to go through all of them.
Thank you. Chris, what about you? How does your organization keep up to date with monitoring and threats?
We we're role-based. So we have a couple positions with the company, VP of IT Ops, and we have a specific role, Chief Information Security Officer. Those two roles are dedicated to cybersecurity and keeping track of Twitter, all the feeds out there. And one of the things that we would like to correct and communicate is some major vendors out there will become aware of the threat, and they won't announce it for 30 days until they have a fix. And even though there might not be a fix or a patch for that threat, if they can let us know about it, then we can contain it. Maybe we could block IPs from certain parts of the world, or put in different layers of protection. And so we're constantly looking for new ways to get more information, quicker information, reactive information, and continuously build these defenses when we learn about information.
Thank you. So given that there's a lot of cybersecurity experts in the room, I'd like to ask each of you what tools would benefit your organization if readily available. Andrew, let's start with you.
So, sorry, this was tools?
Sorry, there is a lot of echo here. What tools would benefit your organization if readily available?
So the best tools are honestly the ones that are automated. Finding something that works in your system, that can monitor your system, that can take action on items, that can lock accounts automatically. Those are the biggest impacts. Anything that you can automate, you should attempt to automate. That allows you to spend your time reading those emails about CVEs, right? It allows you to take action in other ways, be more proactive in your environment rather than being strictly reactive.
Okay, Roby, what about you?
It's a little bit different for the hospital. I think it's not just automating the tool, but giving our employees and healthcare providers the ability to self-serve, self-help, like resetting your password without having to contact, an actual body, being able to report something suspicious at the push of a button versus having to call a number and wait in a queue and hopefully get a hold of somebody. We found those types of tools very useful, not only in the satisfaction of our doctors and nurses, but in helping to prevent, incidents of cybersecurity issues.
Right. And a little follow-up question for you, Roby. What about the consequences of HIPAA and how does that factor into the tools that you have built?
It's everything. HIPAA and high-tech rules, govern everything we do when it comes to our information and privacy, protecting personal health information, PHI, and personal identifiable information, PII. There are heavy penalties involved with those if you're involved in a breach and you don't report in a certain amount of time, or you just don't report it at all. And it also depends on the amount of information that is leaked or is unfortunately revealed for your organization. One of the big things I think that hinders us a lot in the healthcare industry is the unwillingness to share when an incident occurs. And I think it is because of those rules and laws that healthcare or hospitals that are hit with ransomware or other cybersecurity threats are very hesitant on sharing the information with their peers and other organizations until they have, fully vetted it through their legal and reported it to HIPAA beforehand.
Thank you. Chris, what about you for tools that would benefit your organization?
I think to leverage on what you said about sharing, it's getting access to information, sharing information, not making certain companies liable when they do share information, get that information in a timely manner and different. We have all the normal tools that you would expect a company to have. We do external pen testing, sure everybody does that. But in medical device, there's also a structure. And so it goes back to the culture. It's not just having the technical tools, we also have the procedures and processes in place to deal with when instances arise and very methodical.
Okay. And Tom, what about you? What tools would benefit your organization being a med device manufacturer?
Well, developing any type of product is complex these days. There's hundreds of software components within it. So when we're monitoring each of these software components, it's like drinking for a fire hose. You get CVEs on, some keywords because somebody decided to name their product very generically. Sorting through all the information, figuring out what applies. And I think what would be very beneficial is, having a way to have medical specific ways or terms or, a historical repository for decisions made and filtering specifically through all that information so that we're not just repeating the same process over and over. We're more intelligently looking through the information that's being provided.
Thank you. And Chris, you touched on it a little bit, but can you expand on how you handle incident responses with respect to process?
Sure, so two major frameworks we use is ISO 1345, which has a formal CAPA response, and then HITRUST also does. We take a risk-based approach. Not everything shares the same risk, not everything has the same consequence. So we have a very formal, documented way to handle incident response. And when we look at that, post afterwards, was that the right way to do it? Is there a way to improve that process? Is there tools that come up that allow you to address that, better, faster, and cheaper, so to speak? And so it's an evolving process again. But we document, we do, we come back, and we review our documentation, lessons learned, constantly trying.
Thank you. And Andrew, what about you? How do you handle incident response?
So kind of like what Chris said, you kind of have to, you need a formalized process when it comes to an incident. But before you have a formalized response, you have to define in your organization what you view as a risk and what you view as an incident. So you actually define what incident means. And if you look over the dictionary, it's hard. There's a lot of different definitions, and a lot of people have different risk tolerances and what an incident actually entails.
So how do you address software updates given the context of all of those different vendors?
As fast as possible, but it's a complex relationship. You know, we have software within our system under our control that we develop, but then we obtain systems and subsystems that we integrate to our product as software. So when we're obtaining, and we have knowledge of those systems that, you know, they may be connected to the hospital environment, we have to maintain really good relationships with our vendors. That's both contractual processes to make sure we hold them accountable, but also just, you know, in terms of communication, having clear, open communications, being able to talk to them on, you know, peer-to-peer basis, and really help them understand the importance of these updates. So, you know, making sure that we, you know, remove all the barriers that would prevent us from being able to access or, you know, address threats in an agile manner is first and foremost important. And then the second challenge is, like everybody else said, is the formal verification validation process as followed. Any updates, any changes could positively or negatively impact our system. We want to make sure that our device needs to deliver the medical benefit while not, you know, degrading in performance or usability for the user.
Thank you. And Robbie, how about you speak to your biggest concerns with updating software in the hospital system? That's what you do.
Yeah, change management is the key word in the hospital setting. You've got to know what's going to change, when, how long it's going to be down, who's to, you know, the cardiac unit say we're taking the Wi-Fi down here for the next 4 hours for updates. That wouldn't be feasible. So I think it's critical to have a really robust and mature change management processes and procedures within the hospital setting.
Thank you. So I have one more question that I'll use to wrap this up and ask all of you. What frameworks your organization uses to manage risk with respect to cybersecurity? You know, we mentioned risk management and change control and validation and verification, but let's talk about the framework that enables all that to happen or to manage the risk. And Robbie, we'll start with you.
Yeah, again, the framework, we our overarching frameworks are HIPAA and IFA. So everything derives from there based on our requirements to protect patient information and patient data.
And can you elaborate a little bit more on your cyber defense center and how that works?
Sure. So for some of you who don't know or are from San Antonio, Methodist Healthcare here in San Antonio is actually a division of a larger healthcare company called HCA. We have hundreds of hospitals across the United States and in Great Britain. We actually have our own cyber defense center, which is staffed 24 hours, 7 days a week, that we can reach out and contact for any type of incident response or issue we're seeing. So there are 24/7 firefighters when it comes to cybersecurity.
Thank you. And Andrew, how about you speak a little bit to maturity models and how those factor in with managing risk?
Yeah, and so before I choose a framework for any of my clients, or when they come to me say, I need ISO 27001 because I saw it on the news, you have to basically make sure that they are mature enough to go about that, or it's going to be a long and tedious and hard process for them that they're likely going to fail at in the end, which is kind of negative to think about. But the truth is, if you're not mature enough to implement it, you should probably wait, mature a little bit, then implement something. So there's a lot of maturity models that are out there that you can use as an organization. You can find out where you are. See if you're at the beginning, see if you're ready to implement controls, and see if you're ready to optimize your controls. Those are the most important things that any company can take away from looking at their own self in a self-reflective manner, to see where you're at maturity-wise. Because if you're not ready, if you try to implement some type of standard, some type of compliance standard, or try to meet some stakeholder requirement, it's going to be painful. You're not going to like it, and likely is going to fail or not be sustainable in the long run.
Thank you. And Tom, what is the framework your company uses?
Oh, we use a combination of it. Quality system regulations, which are governed by the regulatory bodies of the market itself, are the bodies. ISO 13485 is quality system framework that was mentioned. We use ISO 14971, which is accepted across, both the FDA and MDR. And then we also look for guidance. FDA publishes a number of cybersecurity guidance for our medical device and also European. But there's a number of different frameworks, a number of different standards, but really I think it's just starts with having proactive processes within your company, your environment, and be able to have honest conversations about cybersecurity so that everybody's educated on this and can speak to it, clear and clearly.
Okay, and you mentioned some more standards, which I said there were a lot. Can you maybe comment a little bit on the impact of all of this effort and standards and regulations on small businesses in particular?
Well, there's a lot of different regulatory bodies we have to comply with, and there isn't really, there are a number of different standards and frameworks, but we kind of have to look at, each individual regulatory environment, and even within the EU or the MDR, each country works itself in that apply. So there's a lot of, traceability. We have to make sure there are processes that we have to comply with, and documentation we have to follow. And we have to kind of do all of that while balancing all the other development activities that we are undergoing. So it is a challenge, especially for a small company, to try to market and sell medical devices and keep up with all the evolving regulations.
But it's awesome so many companies are doing exactly that. To wrap it up, Chris, what frameworks does your organization use to manage risk associated with cybersecurity?
Yeah, we'll come at this at a slightly different angle yet. We work with a lot of very high-tech companies, a lot of PhDs. And one thing that we always have to share with people is that the FDA does not enforce these standards. You don't have to be ISO 13485 certified as an FDA. As a young device engineer in a class 3 device, we receive training. The only thing we really have to comply with is the CFR. So the CFR 820.30 is the design controls of the FDA. And we were trained that if you don't follow the CFRs, code and regulations, I, as a design engineer, if I normally break the law, they're laws, they're not standards, these are laws, I can go to jail. And so what scares me sometimes is we work with these early stage device companies and they say, Chris, I just bought a QMS system for $300 off the internet. And I just replaced Nuco with my company and now I have a quality management system. Does anybody on this panel agree that it's a quality management system? Yeah. And so it's a culture. And I think what we've heard here is that it's a culture. It's just not saying that we have to do it. So the top level frameworks is the CFR 820. We're able to comply with that. And we mentioned ISO 13485, which is a quality management system, design control, purchasing, all that. I will never know that. And it's because cybersecurity is so important to us. June of this year, we have our iTrust certification, which is on the same level as ISO. We have to create 41 documents. And, it's a living, breathing beast, but it helps us become a better company.
Okay, well, with that, I would like to thank all of our panelists for participating and thank you all for your attention. Have a good rest of the conference.
Thank you.
Thank you.